done everything.
Okay.
Did you hit start?
Yes, I did.
What am I supposed to do?
Oh, I'm about to start in 3, 2, 1.
Oh. Let's see.
3, 2, 1, go.
So welcome back. It's good to see you.
Thanks, you too.
How have things been going?
Some things have been good, some things have been bad, that's life.
Okay, can you tell me more about that?
Well, I mean, I've been doing better with using some of my coping skills that you taught me, like the box breathing and the counting and the 5 senses grounding thing. But other things, not so much. I don't know, I'm still having nightmares about some stuff, and found myself avoiding sleep because I don't want to deal with the nightmares, and that's just kind of sabotaging, going to bed, waking up on time and everything.
That would
So
be
some things are good, some things are bad.
okay. That's fair. That would be really frustrating.
Tell me about it.
Do you think there's anything that's like causing the nightmares?
Just past stuff.
Okay. Do you know anything about trauma? Have you heard that word before?
Just in like true crime, like blunt force trauma to the head,
Okay, I hear you. So within the clinical realm, we refer to trauma as like something that's happened to you that leaves a mark. Okay, that would be, so I see that you look confused right now. So it could be something big. So big traumas would be forms of abuse. So that could be like sexual assault, verbal abuse, someone hitting you, things like that. Please excuse that. They're doing construction.
I saw the renovation signs.
Yeah, sorry about that. Then there's also little t trauma, which is small hurts that you accumulate over time that can sometimes build up.
Would like middle school bullying fall under that?
Absolutely.
Oh, okay. So what does that have to do with me?
Well, I'm wondering if any of that would be related to your nightmares.
I guess that would make sense. Yeah, there was some stuff that happened in middle school that I haven't really talked about, but I keep dreaming about those people sometimes.
Okay. That could be very alarming.
Yeah. Especially now that I'm an adult. That was so long ago. It should be just done and over with. It was so long ago. It's not now.
That's understandable the way that you're feeling that way.
Is it though?
It is. So have you ever heard of the book of The Body Keeps the Score?
No.
So it's like a textbook, so I'm not going to recommend you read it because it's real heady. But basically the theory behind it is that our bodies and our brains remember things even when we try not to, or even when our brain suppresses memories. So if we haven't worked through it, their body has a way of remembering and bringing things back up when it feels like you're ready to resolve it.
Oh. But what if it's done and over? What does he mean ready to resolve it? It's in the past.
So with you getting nightmares, that's telling me that this is probably in the part of your brain that is actively remembering, where it's like, oh, this is a problem. Part of your brain is really worried about this. And you mentioned that you were avoiding going to sleep, and that was giving you some trouble with getting enough sleep.
Yeah.
Do you think that that's affecting your life?
Well, definitely. It's hard to wake up for work in the morning, and then when I get to work, I don't want to be there because I'm so tired.
That makes sense. So I'm going to recommend that I'm going to refer you to a trauma specialist.
What's that?
That is someone, so this is outside of my scope of practice. I'm not really, it's not my area of specialty to work with and help individuals with trauma to process that trauma.
Oh.
And while I like working with you and I think that you're a fun client, I would really love you to. I would love to see you get the help that you need.
Well, can't I see you and the specialist?
Well, no, no. While that would be nice, with the paperwork and insurance, I don't think it would cover it with your specific insurance.
It's always insurance.
I know it's difficult and it's frustrating.
Okay. So what makes that kind of therapy different than what we do?
So I would recommend to you an EMDR trained individual. So I know I'm using a lot of acronyms. EMDR stands for, what does it stand for? Eye movement, desensitization. I don't remember exactly. Okay, but what it does is it uses bilateral stimulation, which works with both sides of your body. And what that does is it helps you reprocess memories from the active part of your brain to where it's just a memory.
Oh.
So it's not as alarming, it doesn't hijack your life.
But I don't want to relive and go through those things just to, like, it's in the past. I don't want to go through it again.
Okay, that's understandable. Yeah. This doesn't mean that you would necessarily be reliving it and re-going through it. It would be a way of reprocessing these memories.
Okay. Okay. So like going over a test after it's been taken.
Exactly.
Okay.
And then figuring out how to file it away.
Okay. Okay, I guess that makes sense. So do I need to find this person? Or do you like know people?
I know people. I have 2 people that come to mind.
Okay.
So one is within this agency and one is outside of the agency.
Okay.
So you could look them up. I'm going to give you their cards, and then
Okay.
whichever one you think you would be more comfortable with, then I can set up a meeting with that individual.
Okay.
Or you can reach out yourself.
Okay.
But I want to really encourage you. You've done a lot of work since you've gotten here.
Okay. Thanks.
When you first started coming, you were having a really hard time managing your friendships. You were having a hard time being social. You were getting really anxious in situations, and you've been using different coping skills that you've learned here.
That's true. What would you recommend I work on between seeing you and this next person? Because it's not like I'm gonna get in right away. Like there's gonna be a gap.
Yeah, so I would recommend you continue to use your coping skills.
Okay.
So I recommended journaling a few times back. Did you ever try that?
Once in a while.
Okay. So maybe keep that up. Maybe keep a log of your moods, and maybe when you're going to bed and when you wake up, write down when you have nightmares, so that way you have some data to go off of. I know you like data and charting things. It also might be good to keep track of like your moods and what you're feeling.
Okay. That makes sense.
If that's correlated with anything else.
That makes sense. That would give the next person like quantifiable data to look at. Okay.
And the people I'm referring you to, they're gonna believe you. Okay?
How do I know that though?
That's an understandable question. So I've worked with these individuals before, and they are very understanding individuals. They're very well-rounded. They have extensive knowledge of the human brain. They're very well-trained, and they're very relational.
Okay. Well, that's encouraging.
Do you have any more questions for me?
If I don't like them, can I come back to you?
Absolutely.
Okay. I feel better knowing that.
Yeah, and if you would like to stay in contact with email for that in-between time, I would be happy to do that.
Thank you. I really appreciate that.
You're welcome.
It's been a pleasure working with you.
It's been a pleasure working with you
Thanks.
as well.
I appreciate it.
Thank you.